I'm Venkat Ramakrishnan. I'm a consultant plastic surgeon. I'm based at St Andrews Centre for Plastic Surgery in Burton, Chelmsford, Essex. I practice in South Essex and in London. I've been an NHS consultant for over 20 years, and I'm also a fellow of the Royal College of Surgeons and the British Association of Aesthetic Plastic Surgeons. My work in reconstructing the breast after cancer surgery is one of the most important aspects of my professional life. When a patient hears that she's got breast cancer and requires to have a mastectomy, she and her family are often devastated. They are frightened by the diagnosis and fearful of the future. TUG flap is an operation which involves removing a piece of tissue from the thigh to rebuild the breast. When the breast surgeon finishes the mastectomy, they're going to leave behind the skin of the breast behind. They'll just cut around the nipple areola, remove the breast. So the bag of the breast will be left there with a hole where the areola was. TUG flap is a flap from the thigh. It's in the upper thigh. We take the tissue from the upper thigh. It is a melon slice of skin and fat from the upper thigh with a small muscle there with a blood vessel. We take this and we bring it to the chest. We'll use part of the thigh skin to patch that hole and the fat from the thigh and the muscle to fill the bag. The operation lasts about 4 to 4.5 hours. You'll have to stay in the hospital for 5 to 6 days. The recovery time, the total recovery time will be about 2 months. The first month you won't be able to do all the household activities. Slowly you can ramp up after the second week, and another month before you start undertaking sports, gardening, or even long haul travel. I review the patient's needs and their expectations very carefully with them and their breast surgeon, and we decide the appropriateness of such surgery. This is some of the most rewarding surgery that I carry out, helping women at a very difficult time, not only by reconstructing their breast after cancer, but also rebuilding their lives and confidence in the future.